If you're on this video, you're probably looking on something to do with how to do an abortion using Misoprostol and Mifepristone. In this video, I'll just get you through the process in which you can use these two drugs for you to have a fine abortion and probably a safe one. Yeah, so welcome and let's meet after the short break. For you to have your abortion at home using these two drugs, you'll first need the two drugs. The first one is Mifepristone and the second one is Misoprostol. The first thing you'll do is choose a day that you're probably not moving out, you're just relaxed at home. And I'd advise if you'd have a friend or two within the same place you're residing, so that in case anything happens wrongly, you can easily get yourself to hospital. The second thing that you'll do is you'll take one tablet of Mifepristone. Now, Mifepristone usually comes in different quantities. The most common tablets that are made are usually 200 milligram tablets, and you only need one tablet. Anything more than that will cause some severe problems with your health. So you'll swallow one tablet using just normal water. Then you'll wait until a day or two. Now, there's something very important about this. If your pregnancy is below 1 month, it is below 2 months, then you can wait for I think 1 day or even less than 1 day. But if your pregnancy is more than 2 months, then I'd advise you wait for at least 1.5 days to 2 days before proceeding to the next procedure. Assuming you've done the first day, you move on to the second day. Yeah. Now, on the second day, you'll need 4 tablets of Misoprostol. Now, this is a very common drug. It was once used for treatment of stomach ulcers, amongst other things. Yeah. So you need 4 tablets of this drug. It usually has a hexagonal type of shape. Yeah. So you'll take the 4 tablets and you'll either put them under your tongue. Yeah, the 4 tablets. Or alternatively, you could put the 4 tablets in your vagina, yeah, just beyond your vulva, inside your vagina. So you'll put the 4 tablets there and you leave the tablets over there to dissolve themselves, yeah. So one thing I'd not talked about just a few minutes before is that immediately by the end of the first day, if you used the Mifepristone as I'd stated, the first tablet, you'd start having some bleeding, yeah, and the bleeding might vary depending on the size of the pregnancy and other things, but you'll have a slight bleeding. And you might also have some cramping and some slight symptoms that are quite common here. So the Misoprostol tablets are usually come in different quantifications. For this case, I'm talking about 200 milligrams of Misoprostol per tablet. Yeah. So in total, the 4 tablets should give you approximately 800 milligrams of Misoprostol. Yeah. And that is very important. If you use anything more than that, you could easily rupture your uterus. So what will happen is that after a few hours, after you inserting the 4 tablets, you will start having some cramping, and the cramping is usually quite similar to the normal period cramping, and some bleeding, and hopefully the whole pregnancy should come out. Yeah, there have been some cases in which there is a partial abortion, so you have part of the pregnancy coming out and part of the pregnancy not coming out. Now, this brings me to one thing that I usually advise people. If you're doing this kind of abortion at home, immediately you have bled or you are bleeding, I'd advise you go to hospital. I'd advise you go to hospital, and over there they do some cleaning of your uterus, which can be very helpful to prevent any sort of infection, and also just check the overall health of your uterus. And in addition to that, they'd be able to provide you with some antibiotics that can also act as a prophylaxis, prevent you from catching bacterial infections after the abortion. Now, if you have watched this video up to this point, and you're pregnant and you're thinking of doing this kind of abortion, all I can say is I wish you the best. However, if you can, I'd advise go to hospital, to a nearest hospital, explain your situation, and probably they'll be able to have a safer abortion option for you that can be able to sort out your problem. Yeah, so that is also very important. Thank you guys for watching this video. If you have any questions, leave them in the comment section. I would ask you, if you are a new person to this channel, kindly consider hitting the subscription button, enable the notifications, and let's meet in the next video.